So my lived experience was monumental in how I look at justice. I was 19 years old, a new mother on Medicaid, living in subsidized housing, piecing together school, work study, and food stamps. At the time, I thought I was simply surviving, but looking back, that was my classroom. Poverty taught me about policy, resilience, and inequity long before school ever did. The moment I realized that my story could transform systems came years later, when I saw patients facing the same barriers I once faced. That's when I stopped seeing my past as shame and began to see it as strategy. My lived experience is the blueprint that drives my leadership, a reminder that justice isn't theoretical. It's as real as whether an individual can afford to purchase their medications this month or not. Beacon is definitely a justice movement. Yes, Beacon fills prescriptions, but more than that, it fills gaps that policy has left behind. Every vial of insulin we dispense is also a statement that life-saving medication shouldn't depend on zip codes or paychecks. In my TEDx talk, Fishing in a Polluted Pond, I use the metaphor of pulling people out of polluted waters, only to realize we must also clean the pond itself. Beacon is both, pulling people out with immediate access to medicine while working to clean the waters of inequity through advocacy and partnerships. My book, Justice for the Health of It. This was born from this vision, reminding us that health justice is not charity, it's a right. Symbolic partnerships and transformational partnerships, definitely different. See, symbolic partnerships love press releases and hype. Now, those aren't bad things, but they're not enough. Transformational partnerships thrive off of accountability. The difference is in the willingness to share power, not just logos. One surprising ally was when hospitals began to see Beacon not as a small nonprofit, but as a system saver, reducing ER visits and uncompensated care. Transformational partnerships ask hard questions, take risk, and invest for the long haul. My job is to keep justice at the center of the table, so we don't just sign MOUs, but actually move the needle for the families that we serve. My goal is to move the delivery of care, services, information, and resources from transactional to transformational. Leadership Beyond Beacon is definitely a voice. See, I founded Equity House almost 4 years ago, and it is the extension of my heartbeat for justice. The work of Beacon is a critical wraparound service, and I am passionate about the mission and the life-changing work that we do daily. But my consulting and speaking work, that allows me to widen my justice lens. I see myself as a translator, taking data and lived experiences and turning them into strategies that leaders, funders, and policymakers cannot ignore. Balancing all of my roles is not easy, but they all feed off of each other. My teaching informs my advocacy, my book opens doors for speaking, and my consulting brings everything full circle. Over the next 5 years, I see my voice pushing harder into national policy and mental health equity, particularly for marginalized communities where faith and culture must be honored in care. My faith isn't separate from my work, it fuels it. When I searched for a counselor who understood both my cultural background and my faith, I waited 9 months. That's far too long for anyone in crisis. That personal frustration became my conviction. Physical and mental health care must honor the whole person, not just the diagnosis. Justice means making space for identity, faith, and resilience as part of the healing process. I want other leaders to see that faith and justice are not opposites. They are twin forces that can dismantle stigma and build hope. Bold script for health equity. Well, my script would start with access. Every uninsured and underinsured person in our region would know that medication, education, and advocacy are available without shame. Next would be workforce. Training community health workers and mental health counselors and other frontline medical professionals who share the same values and look like the communities that they serve. And then third will be integration. I don't just want siloed programs. I want schools, hospitals, nonprofits, and funders pulling in the same direction. Risky? Absolutely. But cleaning the pond requires more than one fisherman. It requires a fleet. A barrier to justice that I absolutely despise: cost. The toxic idea that health is a commodity. Imagine a world where folks no longer have to ration medication, where counseling doesn't require a 9-month wait, where equity isn't dependent on fundraising galas. That's the miracle I work for, where access isn't a privilege, it's the air that we all breathe.